Very good evening to everyone who's with me and who will see this video. I know बहुत late मैं इस वीडियो पे लाइव आ रहा हूँ, but today there was a patient who came for follow up and का tummy tuck किया, and she just said कि उन्होंने यूरोप के बहुत सारे डॉक्टर्स को देखा है that they have beautiful results of tummy tuck, and क्यों इंडिया में we are not able to create that kind of a result. So I wanted to discuss this because बहुत valid point है. क्या इंडियन प्लास्टिक सर्जन स्किल कम है या there is some other factor at work? So we need to, it's very important video for all the patients who want to come to India for plastic surgery, but they feel that somewhere the results that we are putting up are not as great as what a lot of European and American plastic surgeons are able to create. Now the reason for that is very simple. BMI. Indian patients who we are operating every day are much heavier in their overall structure compared to American and British or European plastic surgeons. I know for a fact that in US and most of Europe, patients who are above 26 BMI or 20 at the maximum 28 BMI only are operated. In India, the starting range of patients who come to us for tummy tuck is almost 30, 32. The average BMI that is operated in India by our plastic surgeons is 34, 36. We had a patient with a BMI of 40 who was operated. Now you can imagine these are patients who can never be operated outside India. You go to a British plastic surgeon, you go to an American plastic surgeon, you go to a French plastic surgeon. If you're above 26 or 27, they will not operate you because that spoils their results. Their series gets spoiled. The beautiful snatched figures that you see of foreigner plastic surgeons is because their patients have bigger height, they are thinner, and they have a better, you know, frame of mind towards being fit. Indian patients have a lot of intra-abdominal fat or visceral fat. They're shorter in height, they are heavier in general. And the whole mentality towards fitness is a little lower in Indian patients. Absolutely correct, Lavanya. You're absolutely correct. Now you can imagine if you feel that at least our results are 80 or 85% of what an American plastic surgeon creates with that BMI of 35, 37, 48. Just imagine the magic we can create when an ideal patient comes to us. So if you as a patient have a BMI of 36, there's no way you can compare results with someone operated in US with a BMI of 24 or 26. The surgery intensity to bring that 36 BMI patient to a better body shape is immense. You do not even know the amount of liposuction or the effort that is done. I have seen American and European plastic surgeons operate. They hardly do liposuction at all, minimal 500 ml or liter of liposuction, whereas we end up doing 8 liters, 9 liters, 10 liters of liposuction, and yet we are able to create that kind of beautiful results with hardly any skin damage, very nicely snatched waists, good scar quality. But it is absolutely wrong अगर हम कहें कि why we are not able to create those results. First, lose your weight, become athletic, come to 24 BMI, and then come to us and see the kind of magic we can create. In fact, I will go ahead and say that we can create results which are actually better than American and European plastic surgeons because we are trained to do these surgeries in bigger patients and in more difficult scenarios. Now, a person who's trained to do something like this in difficult scenarios, just imagine if given an ideal scenario, what will happen. So that is the important thing that I wanted to communicate through this video to all my patients. Scarring, it's a good question, Sambhav. The reason is because our dermis in Indian patients is thicker. So on Instagram, someone is asking me why is scarring in Indian patients more compared to say the international or the foreign or Caucasian patients. So in Indian patients, there are two factors that are, in fact, Lavanya, that's one more factor, but one of the most important factors is because our dermis is very thick, causes intense more scarring. Then that is the prime reason that we scar more. And then the skin color, the contrast between the scar and our normal skin is much more. If on a Caucasian a scar gets less visible, the scar is very much there. I've seen the best of results globally. The scars somehow are actually not better than our scars, but because the contrast is less, the skin color and the scar is almost the same. You do not see those scars. Whereas in Indian patients, a browner skin, darker skin, whiter scar, it tends to be more visible. So, like I said, it's become a habit. Very good evening, Anaya Khan. She's joined us on YouTube. It's become a habit for our patients in India to complain that we do not give that great results, or why are our scars more. Go and have a look at Caucasian patients and you will see your scars are actually better because of your skin. Compare it with your skin quality. So we guys are actually, I feel proud to be an Indian plastic surgeon. I feel proud that our fraternity actually is amongst the best trained globally. Indian plastic surgeons are amongst the best. You compare stage to stage of a person in 5 years post his plastic surgery training, compare that person with a 5 year post European plastic surgeon, there's a world of difference. Our doctors are way much better. And as we get senior, trust me, our results are at least as comparable and definitely sometimes better than what you get internationally. So every patient who's seeing us, who's an international patient, please be assured that when you come to India, there's in fact a very nice reel. I try to share that. There's a patient from US admitted in some Indian hospital, and then she's talking of the fact that hospitals in India are way more safe, just more cost effective, way more clean, better food, better hospitality, and they feel more safe in Indian hospitals. They say that an average hospital room in US can cost 2,800 to 4,000 US dollars, whereas an average one of the great rooms in India would cost you about $100 at most, 100, $150 at most. And you don't get processed food, you get fresh vegetarian food. So these are the things that she has put up on a reel, and she in fact is writing to talking to international people that you should actually come down to India for something like this. Let me take up some comments and questions which are there. Just give me, I can only take you live if you have a question. आप अपना question post कर लीजिए, मैं आपको अभी live ले भी सकता हूँ अगर आपको question interesting हुआ. uh, so YouTube पे question है, मैंने कराया है 5 month हो गए. हैंड में ड्रेस में समझ नहीं पा रहा हूँ क्या क्वेश्चन आना है आपका. सनी इज आस्किंग कि राइनोप्लास्टी और चिन इम्प्लांट करें, इज इट बेटर? सो यस Sunny, there are 3D there are ways to assess that also, but you know what, हम लोग ना बहुत 3D scans and 4D simulations के ऊपर rely करना शुरू कर चुके हैं. The best results, the best assessment is an experienced doctor. An experienced doctor will tell you which is better. So अगर आपका chin थोड़ा सा पीछे है, then you need a chin projection. Otherwise आप rhinoplasty कितनी भी कर लीजिए, आपकी face की वो look नहीं आएगी. And if you just do chin implant and not rhinoplasty, suppose there's a deviation of the nose or some other problem, तो complete result नहीं आएगा. So Sunny, you can share your pictures with my team 9811994417, and we'll see you, assess you and get back to you. Breast hard है. ओके आपने हमारे साथ सर्जरी की है तो एक बार रिव्यू करने आ जाइए मेरे पास, और कहीं और से की है तो भी रिव्यू कर लीजिए, एक बार असेस कर लेते हैं क्या प्रॉब्लम है. So Mr. Modi on Instagram is asking, my wife is 34 years old. We just got married. She's skinny, but she's got belly tummy. I'm thinking of lipo 360. Is it a good idea? Yes. So if you're planning a pregnancy in the next 6 months to a year, then you should not do liposuction because a figure aa jayegi, but then with few months ke baad hi she'll get pregnant and lose all that. If you're planning a pregnancy after 3 to 4 years, then do a liposuction now. Otherwise, complete your family and then do a whole mummy makeover. The breast, abdomen, everything. So I hope you've got your answer to this. Very simple answer. Don't do a liposuction if you're planning to get pregnant in 6 months time, because it's a waste of procedure then. Great. Anaya, acha, Hyderabad. I can refer to you. एक बार मेरी टीम से connect कर लीजिए Anaya, then I'll connect you with. So I've got a lot of my junior colleagues in Hyderabad. Some of our trainees, some are doctors who have learned with us are also in Hyderabad. So I'll refer you to one of them, and you can go and have a look, meet with them, and I'm sure some of your problems will be solved. Awesome. So this was an interesting video. I think very good question. So we often pick up these topics from comments which are made by our patients, and they ask us questions, and therefore we make these videos to address those concerns. So, and specifically this video is for international patients who want to think of getting their surgeries done in India, and we have to assure them that we use the best products here, the best breast implants, the best techniques. The standards of hygiene are very very high, and in fact sometimes I've seen some of the international hospitals, our hygiene standards are definitely as high as them. So feel safe when you come to India for your surgeries, and trust Indian plastic surgeons, and they're definitely at par with any other plastic surgeon in the world. So have a wonderful day. I think it's already morning. Yeah, it's 11:57 p.m. So how much is a BBL? So Chantel, if you could, I'm sorry, I hope I got your name right. Just drop us a message or just drop us a WhatsApp on 98 Indian number plus 91 9811994417. Do share your pictures. Let me have a look at that and tell you what all procedures are going to be best for you, and then my team will then share the cost with you, and you can also do a video consult with me once you take up an appointment for the same. Great. So, okay. Is it better to do a breast augmentation? Mr. Modi, breast augmentation with silicone breast implants is the best. Don't do a fat injection, especially if she's got an A cup size. Then it's useless to do fat. Anyway, I'm not a big fan of fat because so much of it gets absorbed. So a breast implant is always better, and she can always breastfeed after a breast implant, and especially with the dual plane technique that we are specialized in, there's absolutely no problem in doing a dual plane breast implant before pregnancy, because you can definitely breastfeed, absolutely no problem at all, and you'll get a good projection, very nice. A dual plane allows you the breast to come up, come inwards medially as well, gives you a much better shape. uh, अनाया आपका क्वेश्चन समझ में नहीं आया. Sabine implants. Sabine implants and Motiva are the best in India. Sambhav, it has been discussed many times with you. I think I have also met you. You met my team, so I don't think why this question has come up, because this has been discussed many times with you, and we have told you not to get this revisions done. It's not going to help you. Right? Great. So have a wonderful day ahead. Have a wonderful morning in a few minutes, and I'll see you very soon. हाँ, बिल्कुल आप कर सकते हैं. हमारे यहाँ से हेयर ट्रांसप्लांट अगर आप करना चाहते हैं, मेरी टीम से बात कर लीजिए. 9811994417.